time, and it's a thrill to have the opportunity to partner with your group, and to be able to really form a connection and a bridge into what we're doing with innovation in prostate cancer research, particularly in the area of survivorship care and how to help patients take better care of themselves, and how to help providers take better care of their patients, and linking everybody together. So I'm going to start by talking a little bit about innovation in prostate cancer care, and a little bit about innovation in general. So, how do we describe innovation? What is innovation? Well, what are the features that we want to look at when we look at how we bring in something new into whatever it is in medicine? Some of the questions we answer ourselves are, what are the desirable features and necessities of innovation? What major innovation has occurred in prostate cancer? What have we done in this area? Aside from treatment and diagnosis, how have we really helped patients? And how do we evaluate and embrace innovation in a new way? And what examples can we follow, and what examples, of course, can we not follow? Well, when we think about desirable features of innovation, or what's called surgical innovation, we have to think about things that are able to be applied easily and consistency in practice, that are appropriately sensitive to actual uses of the term. We want to make sure when we call something innovative, it really is innovative, and not just a different twist on something that we're already doing at a lesser cost. We have to think about comprehensive things, enough to identify the full range of surgical innovations, able to distinguish between innovation from variation, and innovation from really the introduction of new ideas. And of course, whatever new innovation we want to introduce here, in this case, it's surgical innovation, but it can really be to survivorship innovation. We want to make sure something that it is something that is prospective and focused, and features on the relevant things such as safety and evaluation. When we're in the operating room and we talk about innovation, say, what do we do that's different? How do we help patients? Well, what do surgeons say? What do oncologists say? Well, there's an interesting study in 2014 that looked at this and asked some practicing surgeons, what do they associate with innovation? Well, there's a newness factor, of course. There's something that provides a degree of change to what we're already doing. There's a degree of risk involved, because if we're not disrupting a mechanism and we're not creating a small measurable risk, we're not innovating. And that's really the key. We want to get uncomfortable. We want to have a pain point to attack something in a way that puts us at a little bit uncomfortable. And that's what innovation. That's where innovation starts. We also, of course, want to have a direct impact on patient care, and involved in some formal processes that are measurable and that are evidence-based and risk adaptive. So few would disagree here. Everybody knows this ad, that music and Walkmans and iPods and CD players, I mean, they've been around for a long time, but Apple really put a new twist on this. And this is a great example of what innovation is. When the iPod came out, everybody thought it was the greatest thing since sliced bread. And truly, many people still believe that. I certainly have one, and many people have one, and certainly think there's been further innovation in this regard. But this is a great example of what innovation is. They took something that we do, and they totally changed the way we experience it to improve the quality of our lives. Now, Steve Jobs here from Apple says that innovation distinguishes between a leader and a follower. So this is real important advice that I follow, and that many others follow who try to innovate in this field. So how do we innovate in survivorship? We use this, and few people do not understand that survivorship starts on day one, and survivorship starts the moment you get your diagnosis. Now, the way that links into the current slide here is that we are developing an innovative strategy to link patients and their data into what we call the big machine, right? Now, down here, you'll see that your provider and every big hospital system has an electronic health record. You have an electronic health record if you're a patient anywhere, and these things are linked into what's called the big machine, and I'll describe that to you in a second. We have public health records. If you have a condition that is reportable to cancer care Ontario, such as prostate cancer, your information is reported via public health directories into the big machine as well. What we see here are gene markers. Now, everybody understands that there are obviously new and exciting genetic things that are going on to treat cancer, and there will be in the next 10, 15 years genetic markers and different things that you can do for different cancers, also in prostate cancer, that the information of which is also filtered into the big machine here. What we also see here is that for patients with even things like an iPhone, where that's counting your steps, or blood pressure, remote blood pressure monitoring, all of these sensors and remote patient monitoring systems that are used right now, whether it's an app or whether it's Shoppers Drug Mart, blood pressure cuffs, all of these things, all the information that's derived from this is also synthesized in this learning health system. And this here kicks off information that helps both diagnosis and treatment, improving patient outcomes over here. So what we're doing here is envisioning ways in which we can inform the learning health system, inform providers, and inform their patients a lot more in order to improve the positive outcomes that we get here from this learning health system. And this is what NED is all about. So NED is a personalized survivorship application. It is precision health medicine for prostate cancer survivors. It is an application that can be downloaded from most any place, predominantly the Apple Store, as you were to download an app to your phone. It can be downloaded from the Android App Store, and if you have a BlackBerry, it can be downloaded there. And also, it's available just online because it's actually a website as well. So you don't actually have to have a smartphone, even though studies show that over 65 to 70% of patients at all ages have smartphones. You don't need a smartphone to use NED. So it's all inclusive. And what we did in terms of NED was I envisioned an idea in order to help patients and providers be connected in a different way. Patients need support, they need information, they need to feel connected to their providers, and providers need a seamless way to connect to their patients, get all the information in the palm of their hand, and have the ability to follow their patient's symptoms and survivorship characteristics, everything from side effects of treatment to quality of life metrics in a standardized, evidence-based manner. And that is something that we're not doing very well in Canada. That has only recently started being a very, very important thing in the United States that is now moving over to Canada. Well, NED is the leader in this for prostate cancer survivorship care in Canada and in North America. So a bit about our timeline. When did NED start? Well, when I came back when I was recruited back to Canada from New York City in 2011, I had this idea about innovating prostate cancer survivorship better than what we're already doing. And I took this idea to Hacking Health, which is basically a hackathon where I provided the idea to several hundred health innovators, and we put together a mock Java presentation of what I envisioned this would be. And this was the, I was very fortunate to win that. And of course, I partnered then with the Center for eHealth Innovation at University Health Network, Joe Cafazzo, the lead there, my partner in NED, the preeminent group in Canada for human factors and innovative ways of integrating mobile health technology to care for patients. It's taken many years of defining the product and improving the product. It has not been a very slow process. It's been a very significant long process that has been very expensive, and we've done things in partnership with the Ministry of Health. We are actually the only consumer health application in Canada to have a direct link to OLIS, which is the Ontario Laboratory Information System. We're the only ones to have access to ministerial assets. To basically what that allows us to do is to bring in information directly from the Ministry of Health directly into NED, skipping all the hospital-based information systems and going several layers of magnitude higher than what you would get from your physician. You get it directly from the Ministry of Health, and that includes every single lab analysis that you could get at any lab in Canada. Life Labs, Gamma Dynacare, anywhere in Canada. So that's something that we were very proud of. It took years and years of red tape cutting to finally get that. And we've been so successful in that regard that the Ministry of Health has developed what's called the SPARK program around NED in order to innovate ways in which other consumer health applications can gain access to ministerial assets. We have obviously working with Cancer Care Ontario, Prostate Cancer Canada, and of course our current hosts, as well as TELUS, who are big leaders in healthcare in Canada, to look at how we can integrate NED and how we can improve prostate cancer survivorship care using this innovative way in Canada. It's now available in several places, soon to be available all over Ontario. It's at Princess Margaret, at Trillium, and of course, it's now being scaled to most everywhere in Ontario and soon to be other places within Canada as well. So what is NED? What is the patient experience? Well, we know that survivorship care that I'm talking about happens after prevention, after screening, after diagnosis, after treatment. These are patients who get treated and they recover and they survive. Remember, survivorship starts all the way back here. It starts at the time of diagnosis. And because we're doing better, not amazing, but better at treating patients with a variety of cancers, well, actually survivorship is going up and cancer mortality is going down. I can certainly talk to you all about that and show you many slides. However, it is very clear that in Canada, survivorship is going up. Therefore, the needs of survivors and the healthcare dollars that have to be spent to help survivors is going up. NED is around in order to innovate in this space, to reduce the cost, improve patient experience, and dramatically simplify the interaction between patient and provider. Now, what does NED bring? Now, for prostate cancer itself, the most important things after you're treated for prostate cancer are A, is the cancer coming back? And B, what are the side effects of the treatment that I've received and how can those side effects be minimized? Well, NED does two things. Well, as I mentioned, we have this direct connection with OLIS, so we have all the labs that you need and all the labs that your provider needs directly in the palm of your hand from your history all the way back. So it's not just Life Labs and Gamma Dynacare from the moment you sign up moving forward. There's a historical lab analysis that is automatically provided into NED. The other thing that we do here is what's called patient-reported outcomes. And patient-reported outcomes involve the use of standardized surveys and questions in order to better inform your discussion with your provider. Now, lo and behold, studies now show that patients who are followed better, who are asked questions in the right way to derive the most amount of information, live longer and feel better. It seems like a very obvious thing. If your clinician follows you better and gives you better care and knows what's going on in your life, you tend to do better. But the truth of the matter is that Canadian physicians are not doing this very well, aside from a handful of people in tertiary and quaternary care institutions. It's time that everybody follows their patients properly and effectively in order to improve their quality of life. And NED does this for prostate cancer patients. Basically, it gives patients and clinicians access to the same information in one location and provides a cohesive picture of patients' well-being and enables shared strategies for improved quality of life. So this is what NED looks like if you're the patient. Well, let's say this is a patient named Jonathan. You have several different surveys. You have a quality of life survey, a wellness survey. It gives you notifications as the same as you would get, for instance, on a notification on Google Maps or some other application. You will get a notification in order to complete your timely survey, and that survey gets automatically put towards your physician. You have PSA results, which are available to you. Also, we have a great module called Neds Notes. And Neds Notes is a way in which your provider and your patient see the same information together. If you're a patient with prostate cancer and you had surgery for your prostate cancer, you're not going to get a curated feed of information about patients who are in active surveillance for prostate cancer or patients with advanced and metastatic disease. You're going to get information about what you need to do to improve your survivorship, whether it's continence, whether it's sexual function, whether it's quality of life. all of those things that go into making your quality of life as a post-surgically treated patient better, that is what you're going to get in Ned's Notes. It's an opportunity to reach patients in a very specific category with important news about new clinical trials, new information, new programs from cancer survivors networks and prostate cancer, the Canadian Cancer Survivor Network, Prostate Cancer Canada, all these great organizations that are working to help patients with prostate and other cancers can directly feed information to very specific groups of patients. This is what Ned's Notes looks like. This is what your PSA looks like if you have it plotted. Obviously, you see how it goes up and how it goes down, of course, and the clinical significance of this, of course, needs to be discussed with your physician. This is not a way to avoid speaking to your physician about important things. It is a practice facilitator for physicians, and it is a great empowerment tool for patients. So if you're a clinician here, this is what you see, because not only is there, let me just go back, not only is there a patient interface, well, this is what the clinicians see. So if you have a patient who is an EPIC 26, which is the quality of life survey, or a FACT-P, which is the wellness survey, or different PSAs, you get notifications as well. You see that Mr. Jonathan Smithers here has a PSA. He has an increase in PSA of 3, and you also see everything graphically represented. Not only do you see the PSAs graphically represented, but you can break down the EPIC 26 and the FACT-Ps, which are the two most validated and most useful quality of life and survivorship metrics for prostate cancer. These are plotted as well. So you can go through these with your physician, or your physician go through with you in a with a fine-tooth comb, understanding where your quality of life is improving and where your quality of life may be falling off the charts, in order to further strategize to improve that aspect of your quality of life sooner and better. This is the user workflow. Basically, a patient logs in to Ned, reports symptoms of EPIC 26 or FACT-P. This can be stored, of course, and viewed at a later time, but it's also reviewed by the physician, and the physician updates, of course, the treatment plans as necessary. This feedback loop here is very important. So early reporting of symptoms, early review by your physician, early treatment updates and treatment plans if necessary, but also the physician can also synchronize this information with the PSA and other laboratory data, watch the PSA kinetics, which are the important aspects of watching your PSA, seeing how you're doing, and of course update treatment plans if necessary here. These PSA results are released to the patient as well, and patient reviews these results, and it can be obviously stored and viewed at a later time for further discussion. This flow of information here, with this feedback loop here, are keys to Ned's success. So who can use Ned? Well, it can be the patient, of course, but many patients are not capable of doing this type of information. So if you have a son or a daughter or a wife or a caregiver or a partner of any sort, that caregiver can help that patient, and that caregiver can have their own login to Ned. Of course, the clinician's administrative assistant can do that. There's organizational administrators that can help with respect, and system administrators. These are all back-end people to ensure that Ned works flawlessly. And of course, you have the clinician and nurse practitioners, physician assistants. All of these people here can help in terms of passing the information back to the patient. So in terms of deployments now, as I mentioned, it's currently at the Princess Margaret. It's at several urologist private clinics, and of course, it's at the Peel Regional Cancer Center, Trillium Health Partners, Credit Valley Hospital. So what we have done with Ned is, so far, we have integrated patient-reported outcomes. We have obviously this unbelievable, innovative lab result connected interface, where we are, again, the only consumer health application out there to have a direct connection with ministerial assets. We also have this great provider interface, so that the provider can look and see and integrate the quality of their care with what's going on with the patient here. And again, these patient-reported outcomes are going to be standard. They are going to be the most important part of what you do in terms of your prostate cancer survivorship care with your physician, because we know now that they save lives and they improve quality of life. So why not use it, and why not find a very integrated way to incorporate that into practice in an effortless manner, so you're not in your physician's office for hours on end filling out surveys. You're doing this from the comfort of your own home, with sitting on your sofa, understanding, truly spending the necessary amount of time filling out these surveys in the best possible way. So in the future, what's happening right now, and this patient self-enrollment piece is going to break this and Ned out to the rest of Canada. So we're going to have an opportunity to create a situation where patients in all provinces can utilize Ned for further innovation. And of course, for patients with advanced disease, as I mentioned, we have remote patient monitoring tools. These new strategies of drugs and medications that are used to treat patients with advanced disease are monitored by blood pressure monitoring, weight monitoring, all these important things to make sure that a patient is not having side effects related to the new drug that they're on. Well, guess what? Very soon, Ned is going to have is going to be, for appropriate patients, have the ability to capture all these patient parameters into Ned to synchronize what we're doing with Ned with what is happening with new drugs that are going on. And this is something that is actively ongoing right now. So let's go back and summarize this here. So the Ned app is a prostate cancer survivorship tool. Once the app is downloaded, it works to support the patient by providing a three-way communication for patient, physician, and caregiver, helping to quickly and clearly articulate and receive timely patient data. Why do we need to do this? Well, the Ned app fills a void in prostate cancer patient journeys. It enables real-time communication, the link between your physician, your patient, potentially their caregiver. This link will help to reduce the waiting, anxiety, all having the significant impact on a patient's quality of life. The app will work to encourage patients to engage in their journey and work to intercept critical changes along the continuum. So looking at prostate cancer, PSA doubling time, quality of life decreases, changes in symptoms. You don't need to wait to see your physician in 3 months. You can do it now. How are we going to do this? Well, Ned captures, of course, the PSA and the other lab information, as well as patient-reported outcomes into the Ned server. Ned utilizes the Ontario Laboratory Information System, which is the most accurate real-time profile and communication linkage between patient, physician, and caregiver. And in terms of progress, we are looking to determine potential incorporation within integrated care models to support disease progression, in other words, to improve on our ability to determine what disease progression is and how disease progression can have a minimal impact on patients, and how to maximize physician-to-patient dialogue. This is what Ned is all about. And of course, we work hand in hand with the Canadian Cancer Survivor Network. It's important that you know how to reach them. They are fantastic. They're doing a great job with not only prostate cancer survivors, but across the continuum of cancer groups in Canada. And we are thrilled to have the opportunity to partner with them to bring Ned out for prostate cancer patients and to look at other new innovative strategies we're looking at for other types of cancer, which is ongoing as well. And it has been a privilege to talk to you about Ned today. I'm happy to entertain any questions at this point.
Thanks so much, Dr. Feifer, and thanks for the kind words at the end of your presentation there. We appreciate it. We got a couple of questions in line here, and I just want to remind everybody that if you do have a question, now's the time. We have quite a bit of time here to answer some of these questions. You can just type them into the window box on your right. And in the meantime, we have some questions waiting here that are really good ones. First one is, what exactly is TELUS Health's role in the development of Ned?
So great question. So TELUS has been not involved in the development of Ned. Basically, we did this independent of any significant corporate entity at every level. The reason why TELUS is interested in Ned is, and we're interested in understanding how we can provide help to TELUS, is that TELUS is a leader in Canada in terms of health innovation. And they have developed some incredible patient portals and electronic health records for patients. that is the most common EMR that is used in Canada today by the majority of providers. So what they are looking at doing is creating ways in which their data can be compartmentalized and synchronized with what the patient needs. If you, for instance, are a prostate cancer patient and you're seeing your provider, why not have the most important kernels of data from the entire EMR brought out and displayed and given context in something like NED? And TELUS is a leader in this, and we are looking actively to determine how we can help them innovate in terms of bringing more value to their patients and bringing improving the survivorship of patients who are with providers who use TELUS services.
Great question, thank you. And sort of a follow-up question here. Who all is involved in governing this app and its evolution?
So it's a great question also. So as I mentioned, I'll just go back to our timeline here. Let me just go back to this here. So as I mentioned at the beginning in 2012, this was my idea, and I came and partnered with the Global Center for E-Health Innovation. So it's myself and the Global Center in partnership with UHN. All the servers and all the information is stored in firewalled, completely secure locations in behind the University Health Network firewall, and the data is stored there. The data is not owned by anybody; it's owned by the patient, and that's the most important thing, because what we're doing right now is innovating in such a way as creating the idea, not creating, but fulfilling the idea that a patient's information is their own. Patient's health information is not mine as a physician. It's not Cancer Care Ontario's. It is the patient's. So when you talk about ways and strategies in order to innovate the way in which data flows, even from a clinical trial standpoint, the patient should have control over their own data. And that has been the most important guiding principle, one of the most important guiding principles with NED development. And the stewardship of this and of the entire project is entirely by our group at UHN and myself.
All right, great question, thank you. Our next question is, can this app be easily extended to other disease groups and patients?
So what makes NED very interesting is that NED is built for prostate cancer. And prostate cancer patients are very particular. There are different things that you would ask a prostate cancer patient about side effects of treatment that are not really applicable to somebody, let's say, with colon cancer or with liver cancer or with lymphoma. Now, the backbone of NED and how we've developed this is certainly amenable, and we are innovating in this way, to certainly amenable to crossing into different disease platforms. Now, the reason why NED has been successful and continues to really show promise at innovating for prostate cancer patients is that it's built built around the problem. We've identified a problem, we built a solution for that problem. We are doing the same thing for colon cancer patients. We're doing it for breast cancer patients, for patients with ovarian cancer, with patients with hematologic cancers. Each patient population has specific needs in terms of their survivorship care. And it's the individualization of those needs and the melding of that with innovative technology that will lead to successful integration of technology for each of those groups as well. NED is the first one to do this for cancer in Canada, by far. And we are actively working on this model for other disease groups. A great question, and certainly my hope is that we build a huge personalized database of applications for most every cancer, so that patients, no matter what their diagnosis, can benefit from this technology.
That's great news, and thanks for the great question. So our next question here says, what is prohibiting healthcare practitioners from properly following their patients better?
Say that one more time. You just went in and out.
Yeah, sure. Sorry. So what is prohibiting healthcare practitioners from better following their patients properly?
So it's a very good question. We all know what kind of environment we live in right now in terms of physicians. There are too few of us, and we are unfortunately required right now to spend more time on administration than we are with patients, believe it or not. So, and it's further going to get worse with the integration of other new types of technology and EMRs that are not like NED. What is happening right now is that your physician, because they are a waiting list, they don't want their waiting list to get too long, and they have too much going on from an administrative standpoint and from other things requiring, things that are research and hospital administrative responsibilities and all these things, to spend the majority amount of time, or I would say a successful amount of time with each patient. I would love to spend a half hour with each one of my patients at every visit. It's just not possible. It's not physically possible for me to do that anymore. And the reason why people are not being followed appropriately is that physicians are cutting corners when they can. And some of these strategies about following patients with risk-adapted, with evidence-based tools is cumbersome on your physicians in their offices or at cancer centers. It's a problem. And when it's being done, you're being given an iPad, or you're asked to fill out a questionnaire on a computer screen when you get there. By that you're spending more time in the cancer center. You're perhaps going to be even later away from your job, things of that sort. So what we thought about was, let's take the most important thing of your visit, meaning that how are you doing, and take it out of the cancer center. Let's put it in the palm of your hand. Let's make you comfortable when you're answering these questions, not when you're going to be finished and rush through things to get into line because you don't want to pay so much with parking, or you don't want to lose your spot in line, things of that sort. Those are real patient concerns. So the reason why it doesn't happen is just no time. And you can break down the time factor into so many different ways, but it's an unfortunate reality. What we want to do is improve that time that you're spending with your provider. We want you to feel confident that your message is getting across to your provider in a better way. We want to make sure that your patient experience is improved, and that that the information that is most crucial to your success in your survivorship plan is getting to your physician on time, and that he or she looks at it in a timely manner. So that is what's happening, and that is what NED, that's the underlying motive behind NED, to improve this and to make sure that your physician follows you in the way that you need to be followed.
Great question, thank you. The next question actually is somewhat a follow-up to the response you just gave. Do clinicians get alerts for patients whose health is becoming at risk?
Yes, they do. Absolutely.
Yeah, perfect.
Yeah, absolutely. Very simple. It's if we determine that you're falling off the curve at any level, then you get your physician gets an alert saying, okay, this person is not doing well. Let's say from a quality of life standpoint, or whatever specific symptom it is. Then that alert can be kicked off to the physician. It is kicked off to the physician right away, and that in turn leads to further rescheduling of earlier appointments. And as a physician, you can get back to your patient very quickly and send them a message saying, I've seen this, I'm going to see you next week, we're going to work this out. Or if you need to come in sooner, you need to come in right now, or whatever it is. These are the things and the strategies that we envisioned with NED.
Yeah, great question. Thank you. So next we have a question that says, for patients, caregivers, and healthcare practitioners who've used the app to date, how adherent were they to filling out the required data?
How say that, because you could have popped in and out.
How well did they adhere to filling out the required data in the app? to date?
So it's a great question also. Now, of course, survey fatigue is a real thing, right? And if you do a survey study, if you get 15%, that's 15% of respondents filling out your surveys, it's honestly considered a success. But for NED, it's different because we have incentivized strategies in place in order to improve the patient's willingness to do this. First of all, it's not going to bother you every day because symptoms don't change very, very quickly in prostate cancer from a day-to-day standpoint. They change from a week to week and a month to month standpoint. So survey fatigue is not a huge concern and has not been proven to be a concern in patients that are already on NED. And we have some innovative strategies and partnerships with some major corporate sponsors to create incentives for patients to further put in their data into NED.
Great question, thank you. Question here asking again, how do we download NED? And is Alberta on board?
So first thing, it's funny you mentioned, you download NED from the App Store or from the Android store. That's the first thing. You will not have an ability to log into NED just yet because you need to connect to your provider. You know, NED is not like Minecraft or like, you know, for those out there with kids, it's not like Fortnite where you can just download it and play the, you know, play the game, so to speak. NED is a connected application. So if, you know, the ideal situation is you are a prostate cancer patient in Ontario right now, you want to be followed with NED, you want your physician to be follow you with NED, then you tell them and they will download it as well. And that strategy and that complete scaling of NED in Ontario is happening very, very, very soon. If you're a PMH or a THP or Trillium Health Partners or Princess Margaret patient, you can download NED right now and do that right now. But all other centers, it's you know, it's this summer that it's happening. So that's the first thing. What was the second question there?
The second question was just asking if Alberta's on board.
Yeah, so I was in Calgary 2.5 weeks ago and a meeting with the groups in Calgary, and the answer will be not yet, but very soon.
Okay, fantastic. Thank you for that great question. Our next question, first of all, they say thank you for a great presentation. And they were wondering if it's possible to have multiple clinicians involved for one patient, for an example, a urologist and a primary care physician. And if so, how would they determine care coordination? Okay,
so it's a great question. And I'm sorry if that wasn't super clear, and I may have not mentioned it at the beginning here, but when you look at this here, when you have a clinician, it can be multiple clinicians. Any clinician that looks at you for prostate cancer can actually log into NED. So you can have your primary care doctor, your medical oncologist, your radiation oncologist, your surgical oncologist, and your, you know, who doesn't matter who else, all logged into NED to see your score symptoms. So NED really creates that hub of that survivorship hub for you for prostate cancer. So all of them can see the information, all of them can help in that regard, you know. And what was the second part?
Just if so, how do they determine the care coordination?
Okay. Well, you know, NED, it's interesting. It's a good point. NED itself is not a, doesn't create a situation where you need to decide who your coordinator is, like on NED. NED is a foundation for information to facilitate patient interaction, meaning that if you're, for instance, if you have prostate cancer and you had surgery and now you're having radiation, you don't have to worry about your symptom scores being lost by one physician and not being faxed to another physician, for instance. You don't need to worry about that PSA that you did down in, you know, some other lab for your urologist, and then you go to your radiation oncologist and that PSA is not available because that urologist secretary or office has not faxed that to the radiation group. That doesn't happen. So NED forms the foundation for all this information to exist for you, centered around you as the patient, that people within your care team can access at with your permission.
Fantastic, great question. We just have a couple more questions here and then we'll wrap up. So the next question is, are radiology reports part of OLIS and NED?
So it's interesting how things work in Ontario. Ontario has, the Ministry of Health has what we call assets. They have the laboratory asset, which is OLIS, which is connected to this. There is their radiology report asset, which is completely separate, a completely separate silo. Then there is the ODB, which is the Ontario Drug Benefit Program, which is a separate silo. And there's the pathology, meaning anytime anybody has anything taken out of them and it's looked at by a pathologist, it goes into a database. That's another silo. So by accessing OLIS, it doesn't mean that we had accessing radiology, ODB, or pathology. However, because we have had success in creating and working with privacy concerns at the highest level, working with the Minister of Health on this, they're very happy for us to begin the process of accessing other types of information. So what is happening right now is that, I mean, it's not a new thing, it's been going on for a little while, is that quite soon NED is going to have not only OLIS access, but ODB and radiology access too, further amplifying the contextualized information that patients are going to be receiving about their care. Now, we have to be careful though, because NED is not an EMR. NED is not TELUS. NED is not, Epic, which is the big EMR that's everywhere. We are a very curated, personalized, and precision application for prostate cancer. So we are not a data dump, and we don't want to be a data dump because that removes a lot of the finesse and the very targeted and clear approach that NED has to survivorship in prostate cancer. But I agree fully that an appropriate amount of radiology information that it helps the patient understand more about themselves and provides that linkage between providers is helpful, and that's why we have a long time ago approach for other sources of information.
Great, thanks for that great question.
Next
question is, sorry, go ahead.
No, I will add one thing. That It took us 3.5 years to get through OLIS. 3.5 years, and it wasn't a cheap thing at all. So in terms of research dollars, what we need, what we're always looking for is more, more runway, basically, to further innovate and to further create a much more elaborate connective tool, even though NED is a wonderful foundation. So, that's what research dollars go into, and creating that. So it's happening, but slowly.
Great, that kind of brings us to the next question here, which is, do you foresee there being any challenges in expanding into other provinces where there isn't a system such as OLIS existing?
So in most provinces there exists a system like this. There are a couple there, it doesn't. Believe it or not, the strongest ones are Alberta and Saskatchewan, where there is, OLIS exists. It's not called OLIS, but it exists. We've had wonderful conversations with ministerial representatives, in other provinces, and we are actively moving forward. And there seems to be we've had it's amazing that you do something innovative and successful, thankfully, in one province, and it seems to open doors in other provinces as well, because a lot of the main concern here is privacy, and since we have adhered to and followed and implemented these most strict privacy guidelines in terms of software technology, encryption, and everything that comes along with that, other governments are very happy to do this because, believe it or not, there is a very, very important focus on survivorship in prostate cancer in most other provinces. And we are working with BC, Saskatchewan, Alberta, Quebec, Manitoba is not there yet, but getting there. And the Eastern Canadian provinces are not all there yet, but we're working with some local champions to improve those odds. And it's going to happen. It's not a matter of if, it's just when.
Yeah, great question. Thank you. So this is our last question before we wrap up. And it is, does the app and Pro have the option of languages other than English?
So great question. We are actively doing that. We're moving obviously to French, which is of course the other official language of Canada, and we are working at creating several others. It's not a cheap thing as well, So all this takes money, and we're further innovating. We have a list of priorities to move forward, and looking at Mandarin, looking at there's several other important, everything from Mandarin to Portuguese to some other languages as well. It's just happening. I don't have the active list with me, but we are working on the French translation first and foremost, of course.
Okay, thanks for that great question. That concludes our Q&A here. Sorry, do you have another?
Yeah, I just want to tell you that it's not as easy as just translating into a different language, because the face validity of the language has to undergo testing. So it's not just translating a slide into French. It's going through a whole process of making sure that your translation is doing what it's supposed to do. So it's not a simple thing. I just wanted to add that.
Yeah, that's absolutely true. Very good point. So yeah, like I said, that was our last question I see here. So with that, we will conclude the webinar.